Drug Radar: Indus Detects the Next Drug Epidemic by Doug Bennett. Read by an automated voice. In the hunt for fresh clues about emerging illicit drug use and accidental poisonings from drugs, University of Florida epidemiologist Linda Kotler and her team cast a wide net. Kotler's group, the UF-based National Drug Early Warning System, INDUS, combs through emergency medical service data. They use rapid, weekend-long surveys and scour the social media site Reddit to get timely insights about new drug use trends. And they collect troves of information from an array of sources, including federal drug seizures, toxicologists, funeral directors, school superintendents, and even curious journalists. The goal is simple: collect and analyze divergent data about drug use, harmonize it with other figures, and disseminate the information as quickly and widely as possible. We want to figure out where the next overdoses are going to occur, Kotler says. The INDUS Coordinating Center occupies a unique position in the world of epidemiology. When UF took over INDUS in mid-2020, Kotler envisioned a nimble group that could put out crucial information about drug use trends in close to real time. She also aspired to substantially build its audience of health departments, emergency medical, and other groups and agencies on the front lines of substance use. From a base of 0 subscribers, INDUS has grown its weekly briefing list to over 6,400. To do that, Kotler assembled a leadership team from 3 universities. The group includes a drug use epidemiologist, a forensic toxicologist, a Florida Atlantic University associate professor of psychology, and a distinguished psychiatry professor who specializes in substance abuse. Kotler is a professor in the College of Public Health and Health Professions and the College of Medicine. INDUS has deployed a host of innovative drug surveillance methods in recent years. Its Rapid Street Reporting program sends college students into communities to gather real-time substance use data. The students conduct brief anonymous interviews with local residents. Since 2021, they have done surveys in 21 cities. The survey covers about 100 drugs and documents their adverse effects on people. It also details the rise of new psychoactive substances. As INDUS's other tools are deployed, a timely picture of current drug use comes into focus. Reddit scraping, led by Elon Barinholtz, an INDUS co-investigator and FAU faculty member, helps to detect early signs of new drug trends, although it can lack location specifics. Dispatch data from 911 centers are used to generate heat maps of overdose activity, including the time and day, helping to target interventions. Reddit discussions offer snippets of information that have reliably correlated with drug use in communities. When paired with data about fatal drug overdoses and drug seizures, a detailed picture emerges quickly. In one instance, anecdotal reports about pentobarbital, a potent sedative, emerging in the illicit drug supply were rapidly investigated and turned into a published paper. We're uniquely situated to identify emerging drugs. We want to impact the degree of drug use and mortality by disseminating reliable information, says Bruce Goldberger, a UF forensic toxicologist and INDUS co-investigator. For the INDUS team, agility matters. Drug use trends can change as quickly as an illicit chemist can alter a molecule. Drug laws and even medical examiners' testing struggle to keep up. One molecule can change and it will not be illegal, Kotler says. While the chase can be exhausting, INDUS continues to be successful in its pursuit of emerging drugs. Kotler's team was among the first to notice an uptick in the use of pink cocaine, a misnamed drug cocktail that typically contains the anesthetic ketamine and other drugs. INDUS is seeing psychedelic mushrooms consistently ranked as the 3rd most used illicit drug in the country. Fentanyl, a potent pain reliever, is now being laced with an array of non-opioid sedatives and anesthetics INDUS has found. Depending on the substance, people who ingest illicit fentanyl have reported numbness, irregular heartbeat, and other complications that can land them in the intensive care unit. One of the anesthetics, a veterinary sedative known as medetomidine, has led to an alarming increase in hospital admissions. We received a query regarding the appearance of local anesthetics in the illicit fentanyl drug supply. People are complaining that their arm goes numb when they inject fentanyl, Goldberger says. 16 Sentinel sites around the country collect and submit data to INDUS, giving the group consistent and timely access to local drug use trends. When 9/11 heat maps indicated a rise in overdoses had landed Chicago in the top 10 nationally, they asked INDUS for a longer, more detailed report on drug activity in the area. Similar requests have come in from authorities in Washington State and New York City. That, Kotler says, helps local authorities deploy law enforcement, emergency services, and overdose prevention resources. Just this year, INDUS's hotspot alerts have identified an array of drug use trends that otherwise might go undetected on a broader scale. From the Idaho Panhandle to Martin County in southeast Florida, overdoses involving the opioid-like substance kratom were uncovered. Overdoses involving tianeptine, an opioid-like substance nicknamed gas station heroin, were spotted in areas as diverse as rural northwestern Michigan and the Denver metro area, as well as 23 other counties nationwide. As a testament to INDUS's value and relevance, Kotler notes the group's weekly reports can change right away depending on what is happening. We think every week about what we're going to publish. And then, all of a sudden, something turns up in South Dakota or Atlanta, and we change our report completely, she says. The National Institute on Drug Abuse recently reaffirmed UF's role as the INDUS Coordinating Center. This information can help communities know where to distribute resources like the opioid overdose treatment naloxone, or target other services or prevention interventions. The recent renewal of a cooperative agreement demonstrates NIDA's commitment to this program and the importance of continuing to identify new indicators of changing drug use patterns and disseminate this information to communities who can use it to inform their public health response, says Wilson Compton, NIDA's deputy director. For INDUS Deputy Director Joseph J. Palomar, current data such as law enforcement drug seizures and poison center reports are paramount. Officially, he's a professor of population health at New York University Langone Medical Center. Practically, he describes himself as a drug use epidemiologist. Palomar brings a unique level of lived experience, something he says helps him thrive on the job. He once passed all the screenings to be a New York City police officer, but was too young to join the force right away. But the next thing I knew, I was a fixture in the New York City after-hours club scene, Palomar says. I was surrounded by drugs, ecstasy, ketamine, GHB. Later, I was working on club drug research studies at NYU. It's almost been a quarter century, and I'm still focusing largely on party drugs. Palomar, who has helped raise awareness about pink cocaine, says fentanyl and other novel opioids should be a major focus due to their high lethality and prevalence in unintentional exposures. One of INDUS's strengths is early detection and dissemination of drug trends, he notes. And while Reddit has its limitations for epidemiology, it's a useful trend spotting tool. The group has found that chatter about a drug often increases before poisonings occur. That, he says, can buy valuable time for interventions and awareness. It's an early warning system. We focus on drug trends and novel drug trends in as close to real time as we possibly can, he says. In March, their work revealed that non-fatal exposures to fentanyl among children reported to poison centers grew from 69 in 2015 to 893 in 2023, a 1,194% increase. The largest jump was among those aged 13 to 19, affecting 514 teenagers in 2023. The plurality of exposures, 3,009 in all, resulted in a major, life-threatening effect. The findings were published in the American Journal of Drug and Alcohol Abuse. In less than 1 month, the paper was covered in over 100 news stories, blogs, social media posts, and other online sources. It is among the first analyses examining the prevalence of non-fatal fentanyl exposure among children. The authors say their results show an urgent need for more prevention and harm reduction. Kotler says that includes safely disposing of used fentanyl patches, controlling kids' access to medications meant for others, and educating them about the drug's dangers. Parents need to be keenly aware of the symptoms of overdoses in children, the authors noted. Even those who use illegal opioids should be well educated about keeping the drugs away from children, they concluded. The paper made a big impact because it's about kids and the ways they can be harmed unintentionally, Kotler says. Next, the INDUS team is looking to expand the depth and breadth of its work. Kotler says a scholar came from Spain to learn about INDUS and begin a sentinel network there. Meanwhile, Palomar says INDUS new networks, involving funeral directors, school superintendents, and toxicologists, will further diversify the team's stream of insights in near real time. Goldberger, the UF forensic toxicologist, notes that INDUS is the only federally funded, coordinated drug early warning system in the United States. Kotler finds particular joy in mentoring students to conduct primary data collection and contributing to efforts that matter to communities. All of that comes together with INDUS. It is one of the most interesting studies I've ever worked on, she says.